should I have your permission to go ahead? Okay, so after that, I'll review the indication for the scan, and then I'll also make sure my ultrasound scan machine is on, and that the orientation probe is to the left of the screen. Then I'll also input the biodata as well as the last normal menstrual period. So after doing that, I'll ask the patient to lie down, and I'll expose the patient adequately. Then I'll apply my gel in the midline on the left and right lateral abdominal wall. Then I'll smear evenly on the anterior abdominal wall. After that, I'll pick my probe and make sure that the orientation marker is facing the maternal face. Then I'll identify the pubic symphysis and place the orientation marker above the pubic symphysis. On putting the probe on the above the pubic symphysis, I should be able to identify structures like the maternal bladder, which should be on the right of the screen, and it should also be anechoic. Also, I should be able to identify the anterior uterine wall as well as the posterior uterine wall. I should also be able to identify both the anterior and posterior walls of the cervix as well as the cervical canal. So after identifying these structures, I should also be able to identify whether it's an intrauterine pregnancy, and then also the presentation. Then I'll start sliding. So I'll slide on the narrow towards the orientation marker on the screen until I get to the fundus. When I get to the fundus, I'll slide on the broad axis towards the maternal right. Then on doing that, I'll also look for structures once I slide, like the fetal heart rate, the abdomen, and also if there's any placenta or line form. Then I'll slide again on the narrow axis towards the maternal pelvis. When I get here, I'll slide again on the broad axis towards the midline. Then I'll slide on the narrow axis away from the orientation marker towards the fundus again, looking at structures. Then when I get to the fundus, I'll slide on the broad axis to the maternal left. At the broad axis, I'll slide on the maternal left. I'll slide on the narrow axis towards the maternal pelvis. Then when I get here, I'll slide on the broad axis towards the midline. At this point, I'll then lift the probe for the first time, and then I'll rotate anti-clockwise 90 degrees. Then I'll position it on the maternal right, and then slide on the narrow axis towards the maternal pelvis. While doing that, I'll also look out for any adnexal mass or cyst. Then I'll position it on the maternal left and then slide on the broad axis towards the maternal pelvis, also looking at any adnexal mass or cyst. So after doing that, I should be able to identify whether it's an intrauterine pregnancy or not, and what the number of fetuses, also the presentation. I should be able to visualize the placenta in its location, also whether the fetus is viable, the fetal heart rate. I should be able to see the liquor, and then also any umbilical cord. So after doing all this, I'll now move on to my fetal biometry. I'll thank the patient, clean off the gel on the anterior abdominal wall, and then position the patient and document my findings. Then I'll dock the probe properly.